live?
We're live, Jonathan.
Perfect. Hey guys, Jonathan here with Dr. Emer's office in West Hollywood. Right now we're getting ready to do one of our favorite peels for pigmentation, sun damage, texture. It's called Cosmelan. It's a peel for any kind of sun damage that's on the skin caused by either the sun, any kind of hormones, but in this case it's all sun damage that we're targeting. So the first step with Cosmelan is to pretty much degrease the skin and get rid of all the excess oil that's on the skin. So we start off by pretty much just using a medical grade acetone to kind of help get rid of any kind of impurity or dead skin cells that may still be on the skin from the day. We already went ahead and cleansed the skin. Right now we're going straight to the degreasing solution.
What about acne scars, Jonathan? Someone's asking you.
Yeah, Cosmelan is definitely going to help with acne scars and texture on the skin. We also do Cosmelan before any kind of laser with the doctor, which also helps to prep the skin. So this is a very good peel to kind of help even out the skin tone, the texture, along with treating hyperpigmentation. It's a chemical peel that could also be done at home, so if you're out of state, we could definitely do a virtual application either with me or one of our nurses, where we pretty much ship you the peel and ship you the skincare so you heal properly.
Someone says hi to us from Michigan. Hi, Michigan. That's all. What is that, Jonathan?
It's all dead skin cells that we pretty much went ahead and removed right now. So we want to lower the pH of the skin so we get way better penetration from the Cosmelan. You know, typically in treatments that Michael has done before is we've done a couple lasers, some for combined it with Fractora, but today we're strictly applying the Cosmelan and going to give them a great peel.
And our patient sees a lot of sun, is what he told me before. Would you like to talk about why you see so much sun?
Basically, I work in the sun every day as a mailman, so I'm in the sun about 8 to 10 hours. Can't avoid it, so I end up getting a lot of hyperpigmentation, unfortunately. So I do this peel about every 3 months to try to, combat the hyperpigmentation.
Okay, so let's get ready to kind of start applying. Turn right for me.
Hey, Jonathan, is this a good treatment for people of color?
Yeah, you're able to treat every single skin type, Fitzpatrick 1 all the way to Fitzpatrick 6. If you don't know what Fitzpatrick is, it means skin type. So if you're a lighter skin type to a darker skin type, you're definitely a candidate for this chemical peel. Downtime is about maybe 6 to 14 days. Everyone's different. But it's a peel that stays on the skin for about anywhere from 8 to 10 hours.
Is this the same as a VI peel, VI?
It's a little bit different than the VI peel. I think that the VI peel is more of a layer dependent peel, where this is more of a cream based mask that stays on the skin. So the pH of this is a little too high for it to even be considered a peel because you do leave it on for about 10 hours, where the VI peel is something that I'm sure has a very low pH that can kind of, burn the skin sometimes a little bit. But Cosmelan is perfectly safe for every single skin type, Fitzpatrick 1 through 6. You have all your lightening ingredients like kojic acid, azelaic, phytic, arbutin. You have hydroquinone. It's a product that comes from Barcelona, from Spain. And it's a really good product because it's been in the market for about 30 years now. So it's a very big powerhouse when it comes down to treating scars and texture and pigmentation. How are we doing? Do you feel anything?
Feels good being applied.
Feels relaxing?
Very relaxing.
Yeah, some people may feel a little tingle, a little sensation, or depending how sensitive their skin is, but our patient here has really resilient, thick skin, so he's not pretty much feeling anything.
Very common question on all of our lives. Jonathan, what is the cost for this treatment?
This peel is about $1,300 for the peel. I would suggest for you guys to do a consultation with either myself or one of our nurses or Dr. Emer. And then, we need to make sure that we do the skincare to go along with it. We also have another peel called Lightening, which is not as aggressive as Cosmelan. So if people who have been having pigmentation from anywhere from maybe 1 to maybe 3 years, they are a good candidate for that type of peel. Cosmelan is meant for someone who has tried lasers, who has tried everything, and really can't get a result with their pigmentation. That's when we turn into Cosmo.
With the mention of lasers, someone just asked us, do you use lasers on this or just a cream peel?
Yeah, so, with Dr. Emer's protocol, we like to recommend lasers to be done within 2 to 3 weeks to kind of help combat and suppress any kind of pigmentation. This is definitely a prep for anyone who's a little bit darker who wants to get a laser session, but from treating darker skin types, we definitely need to go ahead and make sure the skin is nice and prep and acceptable to receive whatever laser we do. So if you do a Cosmelan or an Enlighten peel, it's definitely going to help prepare your skin to get any laser session either with a doctor or our nurse Matthew.
Just doing a Cosmelan in general will improve your skin tremendously. That's why I'm only doing that today.
Exactly.
Okay, after people have done this operation, do they stay in the hospital or they go home after this?
There is no downtime with this, so patients are pretty much gonna come in the morning or midday and have the peel, go home and leave the peel on for about 10 hours. So, there's absolutely no discomfort whatsoever with this type of a peel. It's basically a pigmentation mask that stays on the skin for about 10 hours, which is gonna go ahead and target really deep sun damage.
And Lisa, you are welcome. We're happy to answer your question. Another one person is asking, is this safe to use during pregnancy?
This is something you would not want to do during pregnancy or while you're nursing. There's definitely other skincare options that we have for you to be done while you're pregnant or nursing. Tuck in your lip really quick.
What other areas can you use this on, Jonathan?
You're able to do this treatment head to toe, anywhere in the body. Legs, arms, calves, inner thighs.
Are there any other common places that you would use this treatment besides the face? Any common places?
Yeah, we've been doing a lot of chest, neck, décolleté. Anyone who has any bad sun damage, so if you live in Florida, we're sure that you have some freckles, so you could definitely treat your skin with this peel. We do ship worldwide, so you pretty much have access to get this peel anywhere in the world.
All right, another viewer has a question. Hi, I recently joined. I have too much pigmentation on my skin. What is this procedure called? Where are you based? This procedure is called a Cosmelan peel. This will help with your pigmentation, and we are based in West Hollywood. We do ship anywhere worldwide.
And we could also do this virtually. If you don't feel like coming to the office, we could definitely ship you the product, and then I could teach you on how to apply this peel at home.
Another person who recently joined is asking the cost. The cost was about $1,300. But of course, you do want to get in contact with us for a consultation. Email, call, DM us. We're happy to talk to you. Thank you. How often can you repeat this treatment, Jonathan?
Well, since, there are a couple formulas for this peel. We do carry one of the strongest formulation there is in the entire country. So typically this peel can be done year round, every 4 to 6 months. Our patient here it's been about 3 to 4 months since our patient did his last one.
Right.
Yeah, so typically anywhere from 3 to 6 months.
And that's only because I work in the sun a lot. If I didn't, I think it would last longer.
What do you suggest using during pregnancy, especially dealing with pigmentation changes after childbirth and nursing?
We have actually the custom dose, which is a personalized serum that we can create from SkinCeuticals that can target the pigmentation. It's called Custom Dose, and it's on our website on emercosmetics.com. Or feel free to set up a consultation with me. Consultations are free, virtually.
All right. Yes, we do ship to the UK. This procedure right here is the Cosmelan peel. We're targeting the hyperpigmentation, and we are going to improve texture. Correct, Jonathan?
Texture and hyperpigmentation caused by the sun damage, which is very common on every single skin type.
Someone's asking if we can treat a skin tag under the armpit. Would that something Dr. Emer can treat here?
Yeah, something totally we could treat. I would recommend for you to either book a consultation with Dr. Emer or the nurse, and we can help you out with your skin tag.
Is Fraxel good for acne scarring, box scar, and rolling?
Yeah, it's definitely a treatment that's going to help with texture. If it's scarring, I would suggest more Fractura or Morpheus, which is basically microneedling with energy. If we wanted to, we can go ahead and kind of boost the results with some microneedling prior to this treatment of the application of the Cosmelan.
And how long will he be keeping this on for?
For about 10 hours.
10 hours. After that, does he just wash it off normally? What is the procedure?
Exactly. He's basically going to rinse it off with cold water and apply a very thin layer of Cosmo onto that day. And then continue doing the skincare using Dr. Emer's vitamin C, hyaluronic acid, along with some dermal repair products that are going to help to soothe and heal the skin much faster. There is a mask that we're going to be doing every single night, which is called Skinzyme, which is an enzyme that helps to eat up the dead skin cells much faster to get rid of the peeling process much sooner.
Is there any downtime / peeling after this treatment?
Oh yeah, there's definitely going to be peeling after this. That's the whole idea of it.
I hear a little chuckle from our patient.
Oh yeah, you're gonna be peeling all that pigmentation, and it's gonna be falling off over the next 4 or 5 days.
Giving the patient brand new skin, the softer skin, along with treating the sun damage on the skin.
And helping with my acne scars.
Exactly.
And pores.
So this is a full 360 of a peel. It helps with pores, scars, texture, but most importantly, pigmentation, sun damage.
It's the top of the line peel, the best peel you can get from Dr. Emer's office. If you want to look your best, that would be the peel to get.
Again, new viewers asking this question, how much are the peels? They are about $1,300. Of course, you do want to contact us for a consultation to get a price for yourself.
We do have other options as well, such as Enlighten, which is about $7.50, or Dr. Emer's Aerify chemical peel, which is something new that we have that does not give the skin any downtime, but it's definitely going to help to target any kind of topical sun damage that might be on the skin.
We have another person asking if we will send the patient home with this on. Yes.
Yes.
He will go home with this. He will wash this off himself after 10 hours.
And we're pretty much able to target underneath the eye, forehead, cheeks, the entire face. It's a peel that's going to be left on the skin for about 10 hours. And it's basically going to help remove all the dead skin and pigmentation that was caused by the sun.
So Jonathan, the peel versus a halo laser treatment. Why would one do one or the other? And the differences.
Do them all together.
There you go.
I've done them all. Do them all.
Exactly. If it's someone who needs to be prepped before a halo, we would do a Cosmelan. If you're a candidate to go into the halo directly, then you can totally do that, but we definitely recommend of getting rid of all the dead skin cells first, so when you're treated with the laser, you're working on a very clean surface.
All right, and we do have a question for the patient. Can I ask the patient what he will do in his 10 hours of downtime?
I am going to just go home and relax like normal, watch TV, eat dinner, and go to sleep. And by the time I wake up, I'll wash my face and do my skincare routine, and it'll be Saturday morning. And that'll be 10 hours later.
Another person asking, can we apply the peel at home? Jonathan, tell them about that.
Yes, you could definitely apply the peel at home. You could set up a virtual consultation with myself, Dr. Emer, or one of our nurses, who is Matthew. We ship all over the U.S. You could definitely do the skincare at home. So we pretty much would do a virtual consultation and then do a virtual application of the peel with us teaching you on how to apply the peel.
And someone else is asking, what is the name of this peel? This is the Cosmelan peel.
We're pretty much all finished here. So if you guys have any more questions for us, please ask now.
Please ask us.
Or if not, send us a DM and we'll be more than happy to reach out to you guys and set up a free virtual consultation.